Is snoring killing you in your sleep? We often think of snoring as that funny or annoying habit that a family member does. But snoring for the most part is nearly never normal. 25 million people in the US now suffer from sleep apnea. And it's well established in the scientific literature that sleep apnea puts us at risk of heart attack. Obstructive sleep apnea causes severe oxygen deprivation during sleep, which damages the brain and deep neural centers. In the daytime, the blood-brain barrier is tightly regulated to protect our brain cells from the outside world. When you sleep, the brain is getting much needed rest. It uses this time to release metabolites which are built up during the day. The blood-brain barrier relaxes and allows cerebrospinal fluid to flow through the neural cells and clean out built-up debris. Sleep apnea causes dysfunction of the rhythm of the blood-brain barrier, which prevent this crucial cleaning process. Its first signs are memory loss, brain fog, and daytime sleepiness. Specific areas of the brain shrink during sleep apnea, and these are the areas that control blood pressure response, short and long-term memory, and breathing centers. The patterns are the same as what we see in chronic alcoholism. Sleep apnea is a chronic long-term condition that leads to a slow degeneration of the brain. Most concerningly, we're also seeing kids with obstructive sleep apnea. In the dental surgery, they present with long faces, open mouths, shadowing under the eye, they report wetting the bed, and they have poor concentration at school. Up to 10% of children are now taking ADHD medications, and research confirms that we know that many of these kids are simply have an underlying sleep disorder. Their brains are starving of oxygen. Snoring and breathing dysfunction is caused by poor jaw growth development that fail to support the airways and proper skeletal growth. If you or a loved one snores or suspect the symptoms of sleep apnea, consult an airway-focused health professional immediately. You may just save their life.